Shared decision making is very important to me and the patient. So we get the patient through the treatment algorithm, and when we get to the point where we can no longer medically manage their erectile dysfunction, we really discuss surgical options and make this informed decision together. Three things have to occur in the operating room. One, the reservoir has to be implanted under the muscle of the abdominal wall. Two, I implant a pump into the scrotum. And three, I place these soft plastic-like cylinders within the erectile bodies of the penis. And these components all connect to pull the fluid from the reservoir into the cylinders and inflate the cylinders to be able to achieve an erection. I typically keep patients in the hospital overnight just one night and send them home the next day. We take the catheter out in the morning, and we take a small drain that we leave to minimize hematoma formation also out in the morning just before discharge home. I work in partnership with the patient's primary care provider as well as a cardiologist that they may have to ensure that the patient is medically optimized prior to going to the operating room. You will be discharged home the day after surgery, and you will need a ride home from the hospital. I typically have my patients prepare starting 3 days before surgery with daily antibiotic washes of the genitalia leading up to surgery, as well as chlorhexidine wash the morning of surgery at home. I will talk to your primary care provider and or cardiologist, because if you're on blood thinners, we usually like to stop those 5 days prior to surgery. Nothing to eat or drink past midnight the night before surgery. A good book to read and your iPad for after surgery when you're just laying in bed enjoying and recovering. There's no need. We'll shave everything in the operating room once we're all set up, and we use special razors to minimize any nicks and cuts in the skin to try and minimize any potential post-operative infection. We'll meet in the preoperative area, discuss the surgery one more time before you go to sleep, and then we'll start you on IV antibiotics in the preoperative area and get the antibiotics in just as we're going into the operating room. And then we'll get everything prepped, ready to go. You'll go off to sleep and we'll go to work. Just think about all the men that came before you that have had this implant placed, and they themselves and their partners have derived great satisfaction. So it's something to think about. I know surgery is definitely not a small feat by any means, but thinking about the improvement in the quality of life, I think will get you through this. I'm happy to field any questions leading up to surgery, and we could even set up a formal telehealth visit if you want to have more of a discussion, or also including your partner in the discussion as well.